friends, good afternoon. This is Yogesh from Tirupati Software. In today's presentation of the video, I am going to present you a software for useful of small clinic, nursing home and daycare center where a doctor or multiple doctors can manage their OPDs, they can perform take care activities and the billing of patients and perform nursing care services, and patient can be discharged to go home for taking small services from healthcare services. And also the application is multi-user multi-system supported, and department based access will be provided for the nurse, small clinical nursing medication dispensing center, and the doctors and the receptionist module like that. So there is a small center can manage their day-to-day operations with accuracy, transparency, and perfectionist to paperless activity if they want to reduce their paper cost in the clinical center or daycare center, OPD center, or nursing home, or small OPD hospitals. Okay, so let's log in with the clinical module. Okay, so once we log in here, we have the respective modules that are will be allocated in the small clinical module software. Okay, so clinical daycare or nursing home, these are the dashboard, appointment, registration, token display, e-prescription, daycare services, OP billing, medical sales, nursing desk, operation, finance report. After that, EMIs reports. If you want to maintain expenses, also will be cover referral management, patient MRD services, pharmacy to manage your stock of the medical product, and central consumable product management system, document, and to send the messages or patient information to the our WhatsApp. So let's go to the dashboard. In the dashboard, the administrative user can observe day-to-day collection of the OPD patient services and the patient quantity for OPD listing. After any billing services, we can access the other department collection revenue like that. And here we can see appointment number, patient quantity, and OPD patient listing, as well as the doctor's availability like that. So these are the, if we click on appointment services, we can see the appointment record which has been registered for today's scheduled patient payment information. Okay, after doing so, we can go to the also main menu, and this is the main. Again, we have appointment module where we can prepare any patient's appointment or telephonic conversation received at the receptionist. So receptionist guys can be prepare appointment either if you are software taking online version, so website integration can be possible with the software, so the patient can book appointment that comes to the patient services on the system. Okay, so where we can prepare patient basic detail during appointment, like Sushil Kumar Sharma, for example. We can collect patient information and the mobile number to sending messages to the patient over if needed. So this way, and the doctors to whom patient wanted to see, the system is check on this event if the mobile number is already existing database or not. We can select the respective doctor, give the time frame when the patient can see, like we want to give this token 5 p.m. to 5:10 p.m. and this way we can prepare appointment of patient, and this will be intimate patient over SMS or WhatsApp or email. Along with the, we go to the record list where we can access all the patient's appointment logs here. Whenever the patient can come to the hospital or the clinic center, the receptionist guys or billing guy can select the patient to perform registration, and they can wish to take the photo, either they can collect patient photographs also, and the basic detail of patient like where he is living, like. Okay, this way we can mention patient demographic detail, name, age, gender, mobile number, salutation like this primary information, and just doing submission of the record, the registration confirmation will be performed. So this is the registration performance. A OPD prescription format can be printed along with the patient's receipt of payment services which he have paid amount for the consultation and registration. After the patients can be go to the waiting area if there is multiple patients are there, so we can mention his vitals record and clinical information before sending the patient to doctor OPD cabin. So let's go in the token window area where nurse can have facility to see all patient listing. This is different doctor. If there are multi-specialty clinic, so all doctors separately patient data will be queue management system can be controlled. Now we go to the particular Dr. Nagendra OP patient like this listing, and we see all the patient listed. Recently we prepared a patient Sushil Kumar. We can select all the patient head vitals record as a nurse, and nurse can mention his vitals record on the system. Okay, like this way. And 65 7 minute by the SpO2, so 55 minute. Okay, like this way. And weight and BMI can be mentioned, and BMI automatically calculated. What is the complaint of patient like? Dengue and cough sick. Okay, duration like 4 to 5 days. Okay, and side for body all, or temperature like 104 Fahrenheit. This way we can mention the clinical records of patient. After, when the doctors calls patient, they can accept the button, and nurse can able to the doctors which have can see the vitals record that was addressed by nurse, so they can access, as well as if they want to prescribe any predefined template of the malaria, dengue, or something fever template profile like that, and they can perform medication and clinical finding and take advice. Okay, like this. If they want to advise any test, so they can add the medical services. If dressing services, IV set they want to apply like that. Okay, we can use the pulse oximeter, and like this way. What are the medicines to be required, like Lindsay for 5 days TDS. Okay, and for 10 days 5 days after meal Reptile using COVID TDS 15 quantity before meal. This way the medication can be prescribed. If any precaution can be also needed to be added to the particular patient, so we can advise malaria prevention precaution like this way, and give the printable prescription to the patient like. So this record will be printed on the prescription pad, as well as this RAM record will be go to the billing desk user. So billing user can be perform billing of the particular patient. So here we have patient list where we can see all the item patient names with the bell icons of any service request are. Like this patient prescribed by doctor services user system asking, do you want to use billing for current item services prescribed? So yes, if we do, so we can get all the item for lab, radiology, hospital services that will be come to the patient billing total auto calculated. If patient don't want to take any particular services like this service don't want, so we can remove, and the amount will be disappear from the billing, but it will be exist in the prescription. Now if we select a payment method, cash, card, UPI, which way the patient wanted to make payment, suppose that UPI, so we select payment and just save and pay. So billing can be done like this way. This was one method of the prescription based auto billing phase. If sometime the doctor don't using prescription but manual we want to use the services, so we can write here whatever service. For example, we want to hospital item services for dressing, okay, stitching services, stitching, okay, and ECG facility, so we can select ECG, and we can do the ECG's item services of the patient, and payment mode cash, card, UPI like this way, and for the OPD billing flow can be performed. Similarly, once this item or services we have performed to the patient, and this patient want to go to the nursing desk window and our daycare with services module, and they can do the billing facility services. Now we go in nursing desk module where we can find out the patient via UHID mobile number or record like that if we have authorized to the doctor. Now we go to medical center and patient can be collect the medicines request, and whatever medicine prescribed by doctor that will be reflect here, and pharmacy user can dispense this medicine in selecting payment mode validation, and the OPD flow will be completed from the system software like this way. Okay, so this is OPD flow over a patient as clinical prescription writing. After, whenever the day end users wanted to go through the collection revenue to be monitored, or daycare patient, what are the daycare services they want to perform, they can see the list of patient. If we have one current dated, we can apply date filter, duration filter to get all patient listing and perform the data if we have like that, and we can do billing services like so. Now we go to the access the revenue report and finance report of the current OPD patients flow, and get all service patient perform. This way the detailed itemized report services of the patient can be accessible by doctor or user, referral report information like that, and how much day collection handover. So this is total collection the user can hand over to the administrator of pharmacy user or any other person like that they wanted to see. Now if we go to the MIS report, the MIS report will give you different kind of the format, like the itemized categories report like this way, along with the if you click on user report, so this will give you different user wise cash collection, like the users, this one user collected UPI collection, cash collection, or total collection, as well as Yogesh user ID based collection. And this can be also bifurcate, like the due pending 17,532, this amount will be also you can compare the due pending billing totaling of the all patients received from this user ID. So this is the payment wise, user wise, and patient wise reporting revenue, and the patient category wise basically report. So this is all kind of patient revenue report like OPI services. If we go for monthly reports, we can apply duration filter, and we'll have all the list of patients report day-to-day revenue from in the different service wise. So these are the revenue report of for this particular month. If the same report we wish to find out in the day-to-day respective doctor wise, so we click on the doctor wise report also, and we'll have all patients report of the different doctors revenue collection. So you can find out the revenues of all kind of the doctors entries. Similarly, this also a different structure of the summary doctor collection for 1 to date of 22nd, or till date you apply duration filter, panel wise insurance. So there are 400 kind of the report will help you to give you a advanced experience for multi-dimension data for patient collection, user collection, revenue collection, referral collection, insurance or TPA collection like that. If we have impanel patients demographic reports and this one, so doctor wise report and head wise report, this can be bifurcated and explore your needs to be multiple service report in the needed of the software. For example, if you wish to get the user report in different services, you go to figure out, and the report will be generated into the user wise or the category wise, laboratory surveillance report, radiology report, turnaround time report. So this report will give you multiple outputs which kind you needed. Let it be downloaded. Okay, so I think taking too much time, because long data filter applied, we will take in short time. Now we go back to access the report in the front view. Here we have the referral module also, where we can get the data, and patient MRD help you to get the patient medical record, pharmacy module, central store, and WhatsApp facility to send the WhatsApp to the patient. So these are key features. If any specific requirement have any user, they can comment or directly contact to our company based website, and they come back to our contact detail below given. Thank you so much. Hope you like the video.